So another reason you may not be getting pregnant is if there are problems with the fallopian tube. Like I said, anything that causes injury to the fallopian tube can cause it, because all of these organs you're seeing, I know that I drew them with space so you can see the sperm moving, the egg moving, but usually even though they are hollow organs, they are collapsed on each other. So like I mentioned, sexually transmitted infection can cause injury to the fallopian tube. Another thing is ruptured appendix. That's interesting. So imagine something happening on your lower abdomen affecting your reproductive organ. So sometimes if you have a history of ruptured appendix, the appendix ruptures because inflammation has occurred. Now that inflammation, sometimes if the appendix is facing the reproductive organ, it can come here and actually cause inflammation of the fallopian tube and cause scarring of the fallopian tube when the fallopian tube is trying to heal. Also, complications from pelvic surgeries such as cesarean section or even some gynecological procedures being done can actually lead to injury in the uterine cavity. So yes, pelvic surgeries can cause injury and scarring to the fallopian tube, but the major cause of infertility due to problems with the fallopian tube is what we call pelvic inflammatory disease. And pelvic inflammatory disease is when a sexually transmitted infection has ascended all the way to the uterine cavity and into the fallopian tube.